I have an example here. My uncle, who is 55 years old, recently experienced chest pain while climbing the stairs. The pain was relieved after taking rest. What could be the reason behind the chest pain? Could it be due to non-cardiac causes like maybe anxiety?
Yeah, that's a very classical, we call it angina or cardiac chest pain symptom, what he is describing, what your dad is experiencing more than likely. So by your dad, I would assume he may be at least in his 60s or 50s, maybe. At that age, somebody with chest pain, when you do some activity, we call it exertional chest pain. So it needs to talk to their doctor wherever they are and do some tests. It can be a stress test, or sometimes it can be something called angiogram or a heart catheterization, and to see if there is any blockage and treat that accordingly. And before you blame it on anxiety or stomach issues or anything, we need to confirm there is no heart problem involved. Because if it's a heart disease, it can be life threatening. So it's very important first to make sure there is no heart heart problem involved before we go chasing other diagnoses. So if it's confirmed to be a heart disease, then there are certain medications they should need to be on, like aspirin. There's a cholesterol medicine. The most common things are called statins. Then if the stress test shows abnormality, or if your symptoms are very concerning, we might directly go to a heart catheterization. So during the heart catheterization, we put a needle through the wrist and pass a small catheter or like a wire kind of a thing called catheter that all the way to the heart, and inject some dye into the heart and take some pictures of the heart on a X-ray camera. And that way we can see if there is a blockage. And if there is a blockage, many a times we can fix with a stent in your heart. Sometimes when we go in, we might find a lot of blockages or certain areas where we cannot put a stent in there. Then they might need something called bypass surgery, cardiac bypass. So those are the treatment options for cardiac chest pain. But again, if your stress test is normal, or if the heart catheterization doesn't show too much of a blockage, then looking for other causes for stomach ulcers or anxiety, whatever makes sense. But first, make sure there's nothing dangerous. I would advise your dad to contact his doctor at the earliest, and please don't ignore it as anxiety or stomach issues.
Mm-hmm. Yeah. You kind of see that often where people will just kind of think their symptoms are something else and kind of put off going to the doctor.
Yeah, very commonly. I have an interesting patient not last year, maybe a year ago during the winter time. It was pretty bad weather, and he had chest pain, and he decided I'll wait out the weather to go to the hospital. And it took about 7 days to come in. And by the time he got to see us, he had developed something called heart failure. His heart was squeezing only about 20%. There are some blood tests we look for heart attack. Those enzymes or blood tests were very high. So he had a big, massive heart attack, and he didn't seek help. He was lucky to be alive, but if he would have called on the very first few hours of the symptom, we could have helped him much better than now. Now he will have that heart muscle damage for the rest of his life, because we all are born with a certain number of heart muscles, like number of muscle fibers, as a baby when you're born. They become bigger and maybe thicker when we get older, but they don't increase in number. So if you're born with 1 million muscle fiber, that's what you have for your whole life. If you, at age 40, if you damage maybe 100 or 1,000, those are gone. Those won't come back. With our current medications and technology, there is no way we can regenerate those muscles. In the future, it might change, but as of now, still that's the case. So it's important to seek early attention and don't ignore.